I have neuropathy in my feet. I've been seeing a podiatrist for at least 10 years. My ex was seeing him before I was, and she recommended I go see him. And it's interesting that after a couple of years of my going to see him, she left him and went to someone else. I didn't actually know that at the time because I didn't really keep up with it. But I figured it out later on that she was going to someone else, at least for a little while. Anyway, we differ politically. I'm liberal, he's conservative. Wasn't a problem initially because doctors are not total idiots. In essence, if you visit them for the first time and maybe you don't see them all that often, they're not going to reveal who they are most of the time. So he didn't really reveal himself on that. We talked about my feet. We talked about what I should probably try to do. We talked about things that he was going to do, and everything was fine. However, over the years, he has gotten a bit too familiar with me, and it's like when he would come into the office, he would start off basically saying something that was going to be insulting in some way, or waiting till I said something, and then he was going to say something that was going to insult me. Now, here's the thing. As much as I will stand up to anybody who says certain things, when a guy has got clippers at your feet and he's cutting your toenails or doing some other stuff, you pretty much decide, okay, I am not going to say anything to kind of get him riled up because I want him paying attention to my health. So I basically let it sit until the last time I went to see him, which was back in August, early August, where I was having some issues with my feet, and I made an appointment to go see him. And I happened to mention to him that I might be going to New York City to consult at this hospital down there. And I mentioned where I was going. He said, oh, you don't want to go there. It's a tough area. A lot of black people are doing a lot of bad things down there. And I'm like, whoa, where did that come from? There's not many black people where I live. And I don't know if he has all that many black patients. He took care of my mother, but he never said anything like that when my mother was there, even though mom had dementia and she wouldn't have understood it. But it's always been me. And I started to wonder if maybe that's why my ex decided she was going to stop going to him. Maybe he was saying things to her that eventually got on her nerve. Anyhow, that was next to the last time. I went one more time because he did an injection in my foot and I had to wait a week to see him. And then the next week we went and we saw something. He says, okay, we need to do this for 4 weeks in a row, twice a week, and insurance isn't going to cover it. But he also said something, and I'm sitting there thinking, no, you know what? No. Now we have reached this thing where, one, I'm not paying this guy out of my pocket for something like this. I don't even know how much this one cost because they couldn't tell me, which later on I found out when I got the bill, it was $250 just for one visit. No, wasn't making that kind of money off of me. And two, I didn't want to hear his stuff anymore. I am not one of those people who wants to talk politics all the time. Matter of fact, most of the time I don't. So that it was going to come up every single time, and I got this guy doing injections into my feet. I said, nah, that ain't going to happen. So I decided to look in the phone book. And it turns out there was another podiatry office, not only in my area, but the same distance from where I live, only in the other direction. So I made an appointment with them. And I go to see them, and I'm sitting there thinking, okay, I want to see how this guy is different. But also, I wanted to let this guy know that I knew something about healthcare. So I had called the other place first without letting them know I wasn't coming back, and I asked them for the codes. I wanted to know what diagnosis codes they had. I wanted to know what the procedure code was, and I wanted to know if they had a code for the injection. Turns out they didn't have that. And he wouldn't tell me what they were actually putting in my feet, which I thought was different. So anyway, I make the appointment. I go see this other guy, and he's totally different. I got to ask him questions about my feet. I got to tell him about coding. We discussed that. I told him what this other guy wanted to do. He said, well, why would he want to do that? He says, actually, I know why, because I had to intern with him many years ago for a couple of years, which I never really thought about that. But I guess if you're not going to work in hospitals, you still have to intern with someone else who does what you're looking to do. So he said, yeah, I know he's got these different ideas and he likes to experiment. And he probably might have been using different things on you to see if any of those were going to take. I don't think you need that. I'm thinking, thank you, good, because that wasn't going to happen. But it was a nice conversation. I was in there actually a lot longer than I've ever been in any appointment with the other guy, who was always late. I mean, you would get there and sometimes you'd get in after 15 minutes of being there, sometimes an hour and a half. It was just him, and he had his nurse and he had the admin person, and that was it. And I just put up with it because I'm one of those people who's sometimes really loyal to something, even if I'm not getting that loyalty back. That's a bad habit. Loyalty is my number one morality principle, but sometimes you have to think more about yourself. So I was in there with this guy for about 35 minutes. The other guy, I think the most time I ever spent in the office with him may have been 5. And that was just him. The the nurse might have come in every once in a while to do some adjustments to something that I had. But in general, that was it. And he was just loud and boisterous, and he wasn't really the nicest guy. And he used a lot of profanity, which I used to sit there and think, wait, you have a lot of older people. I mean, I'm in my 60s, but we're close to the same age. We had older people in there who had to be hearing what he was saying. And I'm thinking, no, that's disrespectful. So saw the other guy, and then he says, okay, we're fine. You don't need to see me for another year. I'm like, wait, what? Because the other guy wanted to see me every 6 weeks, and I had changed that up to once every 3 months. Once a year? And he did this test on my foot, and I said, I could feel everything you were doing, but I could rarely feel what he was doing. He says, well, this is actually the standard that the National Podiatrist Association, or whatever that thing was called, actually test with, but I know he likes to try to get finer. I said, well, now I kind of feel like that was kind of sneaky. So anyway, I'll be seeing this guy once a year. He's right down the street. Matter of fact, he's going to be moving offices, so he's even going to be closer to me than the other guy is. No problem whatsoever. Here's the thing. You have to have trust in the people that you're going to see for your health care. If you're not comfortable with your doctors or the nurses or any of the other staff, you need to go looking for someone else. You might not be in the kind of position I'm in, because truthfully, even though I had this guy who was right up the street, there's like 3 other podiatrists who are within 10 miles of where I live. If I have to drive a little bit further, 10 miles isn't all that bad. But luckily that I found this guy. Don't stick with any physician who you don't feel comfortable with. Admin people, the nurses, you need to be comfortable enough to be able to ask questions. You need to have someone actually tell you real stuff. Someone who's not trying to get you in and out. That's what I have today. Let me know your thoughts. Let me know if you've ever had to deal with any physicians who do that kind of thing to you, and what you did about it, or if you've done anything about it, or if now that you've seen this, you're thinking about doing something about it. My name is Mitch Mitchell. I hope you all take care.